Okay, let's dive in. Ever wonder if there could be, really effective ways to tackle brain health issues like chronic migraines, maybe even cognitive decline, but from your own home? That's what we're exploring today. We're looking at a company called Brightmind.AI. They're doing some really interesting things with personalized neurotechnology. Our mission basically is to unpack how they're aiming to shift brain health management using this advanced at-home tech.
And it's a really important area. I mean, millions of people struggle with brain conditions, migraines, for example, current treatments. They often just don't cut it for a lot of people. Get this, in the US and Europe, you've got about 80 million migraine sufferers. And maybe 25% of them, they're just not satisfied with the options out there.
Wow, 25%. That's huge. So there's definitely a gap.
A big one, yeah.
So how is Brightmind AI stepping in? Their core idea is bringing non-invasive brain stimulation, personalized stuff right into the home. And the really groundbreaking part, they're the first ones taking rTMS, that's repetitive transcranial magnetic stimulation.
Usually big hospital machines.
Oh, exactly. Big, bulky equipment. They've managed to compact it for home use. Now, we should be clear, it's not like tiny, tiny.
No, not pocket sized.
Right. But it's definitely manageable for home use, a huge step away from the clinic setting. Their system uses three main parts, right? The compacted rTMS, then EEG sensors.
Yeah, for monitoring brain activity in real time.
And artificial intelligence, AI.
Okay, but let's clarify the AI part because it's specific. It's not actually adapting the rTMS pulses on the fly. That would be, well, tricky for regulation right now.
Ah, okay. So what is it doing then?
It's more about prediction. The system synchronizes the rTMS pulses to your specific brain waves using something called phase synchronization. Think of it like tuning into your brain's unique rhythm.
Okay, like matching the frequency.
Exactly. The AI comes in to analyze your EEG data patterns and predict when, say, a migraine attack might be about to start.
Got it. So the synchronization gives the precision during treatment, and the AI helps predict the need for it, or perhaps alerts the user.
Precisely. That synchronization is the key benefit over older rTMS. It's the first time stimulation is tuned to the individual's real-time brain state.
Yeah.
Much more targeted.
And that targeting must make a difference compared to, say, standard medication, too.
Oh, absolutely. And look, this isn't just a maybe it's better situation. For migraines, rTMS, when using the right protocol, is already proven to be significantly more effective than many drugs.
Really? How much more effective?
We're talking substantial numbers. Placebo-corrected studies show rTMS reducing monthly migraine days by over 6 days.
6 days? Wow.
Compare that to less than 3 days for many pharmaceuticals. For some patient groups, this tech can cut attacks by more than half in up to 90% of them.
That's a massive difference, and doing it at home.
That's the other huge piece. It removes the need for daily trips to a clinic.
Which, for many people, is just not feasible, right? Life gets in the way.
Exactly. So this makes truly effective therapy practical, accessible in your own living room, on your schedule.
So the wider impact is, well, it's potentially huge.
Me.
Better outcomes, more convenience. Probably safer for many, too.
Definitely.
Yeah.
It improves access massively. It lines up really well with global health goals, too, like the UN's SDG 3 for good health and well-being.
And they're not stopping at migraines, are they?
No, their roadmap is broader. The next big clinical target for them is dementia. They have a vision for tackling cognitive decline more generally.
That's ambitious. And to build this kind of tech, they must be using some serious tools.
They are. It's worth mentioning they use the 3Experience platform, SolidWorks for the actual device design,
Okay.
and Simulia for running complex simulations. They reckon this saved them, several years in development time already.
Impressive. Speeding things up. What about clinical trial data management? I heard metadata mentioned.
Yeah, metadata is in their plans for upcoming trials, but it's actually not in use for the current one. That's more down to some limitations on the clinical partner side, apparently.
Okay. So plan for the future.
Right. But the core technology, the personalized stimulation, the prediction, that's here now. It really points towards a future where managing brain health is much more proactive and personalized.
A future where sophisticated brain care is genuinely within reach for many more people.
Exactly. The potential is really transformative.
So here's a thought to leave you with. Our brain health touches, well, pretty much everything in our daily lives, doesn't it? If highly precise, effective brain stimulation becomes widely available at home, how might that change how we approach not just chronic conditions like migraine or dementia, but maybe even healthy aging itself over the next 10 years or so? Something to think about.